All right, hey everybody, welcome back to another video today. We're continuing this series on what we can do to give ourselves the best chance at having the best health that we can possibly achieve so that we can live as long as possible and at a higher quality of life as possible. And one of the biggest things that we need to address if we're going to aim for that goal is cancer. I don't need to tell anybody how bad cancer is. I think it's pretty obvious. I'm sure everybody here listening knows somebody who has been affected by cancer one way or the other. And clearly, if we want to live our best life, doing everything we can to reduce our chances of getting cancer is huge. So, Christy, can you give some context behind, how bad is cancer, what makes it so bad, et cetera?
Sure. So we know that the leading cause of death is cardiovascular disease. So we have very appropriately spent a lot of time focusing on that. But just after cardiovascular disease is cancer. So first and foremost, it's a huge reason that people die in our country. But apart from that, it's also a really big reason why people suffer in our country. So we call that morbidity. So people having to do things like go to the hospital for side effects of chemotherapy or complications from their cancer, having to spend hours in chemotherapy, not having the energy that they normally do because of their cancer, being in a lot of pain because of their cancer. So it's not just about quantity of life with cancer, it's really about quality. And so, like you said, like to give ourselves the best chance of living what we would call our dream life or our best life, we have to think about cancer prevention.
Another thing, just to piggyback on that, that I think is another big thing is it's just the mental health of it. Like if you have cancer,
Yeah.
it's like even if it's a mild thing that's cured pretty effectively and quickly, there's still that very scary, I have cancer, what do I do about this?
Yeah.
Gosh, there's always that possibility. So yeah, all the physical things you mentioned, and then definitely the mental health things too. So
Yeah.
we know obviously cancer is bad. How can we kind of get us an assessment for our own self when we're working with our doctor about, what cancers I might be at risk for, or why I might be at risk, et cetera?
Yeah, you're right. Risk for cancer is totally individual. Like everybody's going to have a little bit of a different risk profile. So it's really important to think about kind of four big categories. The first is like behaviors. So everyone knows that smoking is associated with lung cancer, but there are other behaviors that are associated with other cancers. For example, drinking alcohol, which could lead to end-stage liver disease and liver cancer. People don't think about that all the time. We think about sun tanning or like exposure to radiation can put us at risk for skin cancer and other cancers. And then there's even some things in our diet that specific foods contain preservatives that can lead to things like stomach cancer. So a big one for those is like nitrates in food, or burned food is like carcinogenic. So like anything where you think of something kind of scalded or that like um, burned look on whatever you've cooked, like that's technically putting you at higher risk for cancer. Um, the second thing is a huge risk factor for cancer, and of course I'm biased because I'm an obesity doctor, but is obesity. So there are actually 13 cancers that are related to obesity. So we have to think about reaching a healthy weight. And everybody, there are a lot of ways to do that. We've done separate videos on that, but weight is something we have to think about with that. Probably the one people think about the most is genetics, like your family history. Obviously, there are certain cancers that are very genetically predisposed, some that we aren't super sure if they are, but they tend to kind of seem like they run in families. Really important for you to know that. And then there's actually some infections that are associated with cancer. So, one in particular is H. pylori. Another is HPV. So H. pylori for stomach cancer, and then HPV for cervical cancer. And so both of those things are important to think about. So that's kind of the main big picture, like how I think about understanding your risk.
Couple things I want to hit on there. You mentioned that, and I think a lot of people will be surprised to hear 13 different cancers that are associated with it, 13 different cancers that are associated with a higher weight level or
Yeah.
associated with obesity. Tell us why that might
Mhm.
be the case.
Yeah, that's a great question. So obviously, we can't pinpoint every single cause, but we have some theories. So, um, obesity is a really complex disease. And the main way I explain that it leads or can lead to cancer, the main hypothesis is When we have extra fat cells that have grown too large and have deposited around our organs, they tend to not work right. And one of the ways they don't work right is they cause damage and inflammation. And anytime something's inflamed or damaged, it has to be repaired. And when it is repaired, there's a chance for a mutation or something wrong to happen in that repair of the gene, and that's how a cancer starts. So that's sort of what we think of as being our best our best guess at how obesity might lead to cancer.
Okay. So then just to summarize on the sort of risk factors things you've mentioned, smoking, obviously, alcohol, I think that's pretty well established. Working
Mhm.
with your doctor to get it to a healthy weight, that's a huge thing. And then genetics and infections were the other two.
Mhm.
So,
Yeah.
I think one people think people probably don't do is talk to your family. Like,
Mhm.
did grandma and grandpa have what kind of cancer? Or was there anybody that had a cured cancer that was 20
Mhm.
years ago that we don't know about? Obviously, mom and dad, siblings as well. Those are obviously a huge thing to just know your family's history.
Mhm.
Um,
Mhm.
so you talked a little bit about the ways we can know if we're at risk. So let's say we are, or maybe we're not sure if we are or not. What can we do about that to investigate that further?
Yeah. First and foremost, the biggest thing is we have to stay up to date on our cancer screenings. That's a complex topic in and of itself, but there are several tests or several cancers that we have pretty good screening tests for. And the whole point there is we want to be checking frequently so we can detect a cancer at like the earliest point it starts. Because of course, when you detect it earlier before it's metastasized, gone distant, it's a lot easier to treat. So understanding cancer screenings are really that's like the cornerstone. That really varies by age, sometimes risk factors, um, and gender also, and family history. But talking with your doctor about like which screening tests are right for you is probably the best way to go there. I can pull up. I want to share a graphic that talks about the obesity related cancers, and I'll show like how many of these like we really do have good screening tests for. Um, so this is the list from the CDC of the 13 obesity related cancers. And some of them that you see here really are cancers that don't cause death very often, but still, again, we're not just talking about like length of life, we're talking about quality of life. And even if you have a meningioma, which is a benign brain tumor, to get that out, that's a brain surgery, and that's a really big deal. Or even a thyroid cancer, that's you're having surgery. So most people don't die from thyroid cancer if they have it, but it's certainly going to be not a fun thing to go through treatment for that, right? So, looking at all of these, we have a lot of screening tests for most of these. So, we know about breast. The recommendation there is that women over the age of 40 should be having breast cancer screening with a mammogram. Some controversy on every 1 versus every 2 years. And with family history, that's going to be different. So, if you had a family member have breast cancer young, you'll probably be having screening earlier. Liver, we don't have screening for that, but we talk about treating fatty liver disease. That's really important, preventing fatty liver disease, because that can lead to liver cancer. The upper stomach, we do technically have a screening test for that if you're at high risk. So people who are at high risk have had like reflux disease for a long time and they get precancerous changes, and then they have screening upper endoscopies. Pancreas, not great screening, but colon and rectum, we also know we have colonoscopies, we have stool tests that you can do. So there's so many options for colorectal screening. Ovary and uterus, not great screening. Kidneys, not great screening. And multiple myeloma is a rare blood cancer that doesn't have great screening. Adenocarcinoma kind of gets back to the endoscopy thing. So a lot of these, we either have something that we can do about them or a way to detect them early.
Well, that's huge. And you mentioned that definitely some of those cancers, are, obviously every cancer is bad. Some of them we don't die
Hmm.
from very often, although it's still bad, but definitely some of those we do. I mean, colon
Yep.
cancer, huge risk of death. Breast
Hmm.
and ovarian cancer, definitely up there. So yeah, I mean, clearly, and while some of this we can't necessarily prove that there's causation there,
Hmm.
um, but it at least intuitively makes sense and in line with sort of epidemiologic data. As you get closer and closer to a healthier weight, you are probably lowering your risk of 13 different cancers.
Absolutely. Absolutely. Yeah. Along with a myriad of other diseases and causes of morbidity and mortality. So, getting to a healthy weight is so beneficial for so many reasons. Again, biased as the obesity doctor, but
Yeah, yeah. Anything else we should know about how we should interact with our doctor um, to kind of talk about cancer risk?
yeah, I think big emphasis on family history. Um, the reason being, like, even if we don't have a screening test for whatever cancer your family had, if I have a patient who I know had, 2, 3 female family members with ovarian cancer and they're a woman, and they tell me that they're feeling bloated, I'm gonna be a lot more tuned in to wanting to make sure that we aren't missing a cancer or something like that than I would if I didn't know they had a family history of ovarian cancer and they're like, "Oh, I'm feeling kind of bloated." I'd be like, sometimes we all feel bloated. So giving your doctor that family history as detailed as you can really helps us tune in to what to be listening for to make sure that we're jumping on something as early as we can, if we hear about it. So that's kind of the other thing I think about, other than like going through your screenings and going talking about behaviors that can be helpful. Um, yeah,
I think as you've alluded to, I mean, screening is so important for cancer because, you know, unfortunately, we haven't made a lot of big headways in the last, 50, 75 years in cancer treatment, whereas in like cardiovascular treatment, while prevention is still, the number one name of the game, and you can really eliminate cardiovascular disease in a lot of people by doing that, there are also really good treatments. But with cancer, there's, there are some treatments, but they're not as great as we would like. And so screening is the name of the game. As you mentioned earlier,
yeah,
the earlier we catch something, if it spreads to your distant, or if it starts in one organ and we catch it before it spreads, our chances of success with the various types of treatments are so much higher. So really the number one thing for, for cancer is screening. And
yeah.
I think that's cool that you've talked about. It's not only just how do we work with our doctor to see what tests should we do, but we've also talked about a lot of lifestyle factors,
Hmm.
um, sort of weight management, certain, behaviors, et cetera, that we can already be doing to make it less likely that those screenings turn out positive.
Yeah, and that makes me think of one more thing. Is like, I tell my patients often that, like, perfect is the enemy of the good. And while of course I would love it if somebody, stopped smoking and quit drinking and lost 50 pounds and got, you know what I mean? Sometimes, whether because of stage of life or whatever's going on in your life, getting to perfect maybe isn't going to be realistic. And we
Mhm.
get that, like, we have real lives also. But losing 5-10% of your body weight, we start to see positive health effects, and I would imagine that that would correlate to probably some reduced risk of cancer, hypothetically. So while of course we always want to aim for the healthy weight, the no smoking, the very minimal to no alcohol, et cetera, like, just reducing those things is also a huge first step in the right direction to reducing your risk of cancer.
Perfect. Anything else you want to say on this topic, Christy? Obviously, this is such a baseline introduction, and there's so many more things to be said, but since we're not sitting one-on-one with the patient talking about this, it's hard for us to go into real specifics, which everyone should talk with their doctor and go into specifics.
Yeah.
Anything in general you just want to make sure people take away after watching this video?
Yeah, I think that's my takeaway. Like, everybody go talk to your doctor, even if you're young and healthy. Like, there is literally at any adult age, there is a cancer prevention that you can be talking about. So regardless of if you've seen the doctor in the last year, 5, 10 years, like, really encourage you to go have that conversation. And there are a lot of options now for screening tests that might be more comfortable than what previously was, always done. So for example, like colonoscopies, some people are like, I cannot do that. Like, we have a lot of options for different screening tests too. So go and talk with your doctor, talk about what tests might be right for you, and make sure that they're tuned in to anything about your family history or your life, your lifestyle, to be looking out for anything that would give them the earliest sign of cancer.
Totally. Just as a quick disclaimer here, we should also mention that you mentioned like as colon cancer as example. There are certainly less invasive options to screen for certain cancers, but you need to talk to your doctor because sometimes they are maybe less effective. So you might be
Totally.
trading, the more invasive test might be like a
Mhm.
colonoscopy is maybe a better test. And we would probably recommend everyone do a colonoscopy that's eligible if they
Mhm.
could, but some people are just not going to get their colonoscopy done no matter what. And so if that's you, we encourage you to reconsider, but there's also other things that we could do that, just as you said, sometimes perfect is the enemy of good. So
Yeah.
perfect. All right. Well, I think that's it. Again, we're just trying to give it some, give really everybody that we can reach some baseline information on things we think you should be able to know, sort of a prevention and of health topics 101, so that you're walking into that doctor's office and you already are informed with some baseline level of understanding that can help you personalize your discussion with your doctor. So hope this helps. If people have any feedback for us or any topics they'd like us to cover, we are all ears. And like I said, if you'd like to see somebody to talk about these things, please reach out to your doctor. And if you don't have a doctor, call us at 360-423-9580. We have 7 different primary care providers there who would be more than happy to talk to you about cancer or really anything, to help you give the best chance of achieving your health needed to live your dream life. So that's enough of me talking, and we'll see you guys next time.